Kia hora te marino, kia whakapapa paunamu te moana, hei huarahi mā tātou I te rangi nei, aroha atu, aroha mai, tātou I a tātou katoa. O tēnā rā tātou katoa, ko Sarah Jane tēnei, he uri ahau no te uruera. Welcome everyone, my name is Sarah Jane Payne and I'm the Research Director here at the Growing Up in New Zealand study. And it's my real pleasure to be facilitating this online webinar today. We've got a really great lineup of presenters and panelists this afternoon. Colleagues of the study and friends of the study who've been involved in the research we've been doing for a really long time and who believe in the vision of Aotearoa being the best place in the world to be a child or young person. So I'm really grateful for all of their time and contribution this afternoon. What we have here on the outline is really two parts to our webinar for you. We have colleagues from the Growing Up in New Zealand study who are going to present to you on their research and to share some of the key findings from their papers. So it's my pleasure to introduce members of our research team. We have Dr. Ben Fletcher here with us this afternoon. And Ben is going to share with you some of the really interesting work he's been doing, looking at young people's experiences of depression and anxiety now that the cohort are 12 years old. And then we have Dr. Caroline Walker, who's a Senior Research Fellow with the Growing Up in New Zealand study, and she's going to look at how young people have experienced the COVID-19 pandemic. And again, I think some really interesting and important reflections on the things that they consider to be worries and fears in their lives at the moment. So they'll take us through their presentations. And then in the second half of our afternoon session, we're going to bring together a panel of colleagues and experts to have a bit of a reflective conversation about what we each see and have been thinking about in relation to these papers, but importantly, I hope to have a starting conversation about what we're going to do to support young people in rangatahi here in Aotearoa to live flourishing lives and to experience good mental well-being. So that's the general overview of our webinar. We do have members of our team here working in the background, so I do invite you all to use the Q&A function. If you've got questions about the presentations, our team might be able to answer them live with you through the Q&A. But if you've got questions or propositions that you want to put to the panel, please use the Q&A for that purpose as well, and I'll try and take some of your questions into our conversation later on. So before I hand over to our first speaker, I do just want to provide a little bit of context. So hopefully everyone online has some visibility about the kaupapa that is growing up in New Zealand, that we have this opportunity to help researchers, policymakers and advocates think about the development and trajectories of child and youth wellbeing across the life course. So the work that we are focusing on today reflects the information we've just recently collected as part of the 12-year data collection wave. So when these young people were aged 12. Our team was all prepared to go out into the field to visit these families who have a strong relationship with in their homes towards the end of 2021. But if you all remember what life was like back then, here in Aotearoa, we found ourselves in August 2021 going into a level 4 lockdown and putting those public health protections in place in our community. So our team had to transform what a data collection wave looks like under those circumstances, and we're really proud to let you know that we were able to conduct 4,500 interviews with the cohort using a remote real-time experience, which is my point to acknowledge the awesome young people in whānau who engaged in the Zoom technology and were able to still complete their questionnaires despite all of the challenges that they were going through and that our team were going through at the same time. You're going to see some really interesting findings today that speak to how young people experience their lives and experience wellbeing. And some of the information you can see on this slide speaks to the diversity and the expansive way in which young people are talking and thinking about themselves. So within our cohort, we have a collection, or a collective, I should say, of young people who understand their ethnic and gender identities in a very broad and expansive way. And so that has enabled us to think about mental well-being and worries and fear in COVID-19 in relation to how they see themselves. So I'm really proud that we're able to share that level of detail in our papers with you as well. So that's probably enough from me. I am here as a guide of the conversation, not the presenter. So I'm going to hand over now to our first speaker for today, Dr. Ben Fletcher. Kia ora, Ben. Thank you.
Kia ora. Thank you, Sarah Jane. I'm going to be talking about the Mental Health Now We Are 12 snapshot, looking at young people's experiences of depression and anxiety symptoms. Now, mental health includes emotional, psychological, and social well-being, and affects how we think, feel, and behave. And it also affects our physical health. Depression and anxiety are two of the most prevalent mental health conditions worldwide, which is why they were the focus of this snapshot. And we know that experiences of depression or anxiety symptoms at a young age can have long-term impacts over the life course, as these mental health concerns can affect approximately 20% of New Zealanders. Understanding factors associated with mental health is critical for informing interventions, public health programs, and policies that may promote well-being. So we looked at depression and anxiety in two ways. First, we asked mothers to report if their child had ever been diagnosed by a doctor with depression or anxiety, and if their child had ever had any contact with mental health services in the last 12 months. We also asked young people about their experiences with symptoms of depression or anxiety at age 12, and we looked at several factors that may be associated with depression and anxiety symptoms, such as gender, deprivation, and ethnicity, as well as household structure, relationships, and mother well-being factors. Additionally, we've previously asked young people about their experiences of depression and anxiety symptoms at age 8, and we used this information to see how symptoms may have changed over time and what factors may be associated with these changes. So overall, mothers reported that 8.8% of young people had contact with mental health services in the last 12 months, and from which over half reported that their child got all the help they needed from these services, while almost 40% reported that they got some of what they needed or didn't get what they needed at all. When asking young people who did not receive all the help that they needed about barriers to engagement with mental health services, we found that 1/3 reported that COVID-19 restrictions or lockdowns were barriers, along with not being able to get an appointment or access to services, and 15% reported not being eligible. Other barriers included having previous bad experiences with mental health services, being unclear how to access services, not finding a therapist or counsellor that they thought understood them, and the cost of services being too high. Although it's important to note here that this includes engagement with both public and private mental health services. When looking at the diagnosis of anxiety or depression, mothers reported that over 5% of young people had been diagnosed by a doctor with depression or anxiety. And of these young people that had been diagnosed, over half engaged with mental health services. Although it's important to remember that just because somebody has a diagnosis of depression or anxiety does not mean that they need or want to engage with mental health services. And the barriers to engagement were similar regardless of if the young person had a diagnosis or not. When we were looking at young people's symptoms of depression, we used the CES depression scale for children, in which higher scores indicate greater depression symptoms, which are shown here on the y-axis. And we found that transgender or non-binary young people reported the highest levels of depression symptoms, followed by cisgender girls and then cisgender boys. We found that young people living in the most socially, economically deprived neighbourhoods reported the highest depression symptoms at 12 years, while young people living in the least deprived neighbourhoods reported the lowest levels of depression symptoms, although these differences were small. Depression symptoms were also patterned by ethnicity, with mean depression scores being higher for rangatahi Māori than for sole European groups. When we were looking at depression symptoms over time from age 8 to age 12, we saw that higher depression symptoms at age 8 were associated with higher depression symptoms at age 12. And over half of young people in the Growing Up in New Zealand cohort reported an increase in depressive symptoms from age 8 to age 12. For these graphs, we have depression score on the y-axis and time on the x-axis with different colors for each of the different groups. Then over time, we found that transgender or non-binary young people and cisgender girls reported significantly higher levels of depression symptoms than cisgender boys. Young people experiencing the highest area level deprivation had marginally higher depression symptoms compared to those experiencing the lowest area deprivation at 12 years of age, although these differences were very small. Differences in depression symptoms between ethnic groups from age 8 to age 12 were also small, but rangatahi Māori, apologies, had marginally higher depression symptoms compared to Europeans at age 12 after adjusting for depression symptoms at age 8. But it's important to note that rangatahi Māori had consistently higher levels of depression symptoms over time. For young people's anxiety symptoms, we use the PROMIS Pediatric Anxiety Shortform Scale, in which higher scores indicate greater anxiety symptoms. And for anxiety, we saw similar patterns to the results for depression symptoms, in which transgender or non-binary young people reported the highest levels of anxiety symptoms, followed by cisgender girls and then cisgender boys. Although we found no differences in mean anxiety symptoms by socioeconomic deprivation or by ethnicity. When looking at anxiety symptoms from age 8 to 12, we saw that higher anxiety symptoms at age 8 were significantly associated with higher anxiety symptoms at age 12. And we found that over 1/3 of young people had an increase in anxiety symptoms. While many young people reported a slight decrease in anxiety symptoms over time, we found that transgender and non-binary young people reported a small increase in anxiety symptoms from age 8 to age 12. And they had consistently higher anxiety symptoms over time compared to cisgender boys. Cisgender girls also had significantly higher levels of anxiety symptoms compared to cisgender boys at age 12, even when adjusting for anxiety symptoms at 8 years old. We found no differences for anxiety symptoms when comparing area level deprivation, and differences in anxiety symptoms between ethnic groups were small. And these differences tended to become less pronounced over time. Over time, rangatahi Māori and Pacific young people had a marginal decrease in anxiety symptoms compared to Europeans who reported the lowest level of anxiety symptoms at both time points. So we've just reviewed some of the demographic factors and how these were associated with depression and anxiety symptoms. And this figure shows a summary of a more in-depth analysis looking at a wider range of factors. For the full overview of these results, please have a look at the supplementary materials that are on the Growing Up in New Zealand website. But the key message here is that even when we adjusted for other factors that may help to explain some young people's differences in depression and anxiety symptoms, we found that cisgender girls and transgender and non-binary young people reported higher levels of depression symptoms at age 12. We also found that being bullied more frequently, experiencing depression symptoms at age 8, and mother's well-being were also associated with higher depression symptoms at age 12. However, having a strong supportive relationship with friends and parents had a positive impact on young people's depression symptoms at 12 years old. And we also found very similar results when we were looking at young people's experiences of anxiety symptoms. So all of this suggests that improving accessibility and availability of mental health services and expanding choice is critical to help reduce the burden of mental health conditions. And we need to ensure that teachers and caregivers are aware that mental health concerns can start early and are often undiagnosed or untreated in younger people. So providing mental health support from an early age reduces adverse outcomes and helps to promote mental wellness. There's also a need for a continued effort to prevent transphobic and homophobic bullying in schools and provide support to help families be a positive place for transgender or non-binary young people. Relationships, bullying, and mother well-being are also associated with depression and anxiety symptoms. So nurturing these conditions and acknowledging sources of social support is critical to help increase mental wellness. So I'll let our panel speak about the policy and practice implications further during the discussion. But now I will hand over to my colleague, Dr. Caroline Walker, to talk more about the COVID-19 snapshot.
Okay. Okay, I think we're good now. Sorry for that awful feedback. Let me begin. Okay, so thanks, Ben, for that great talk of snapshot 7. I'm now going to tell you about snapshot 6. So this topic investigated worry due to the pandemic in young people, and it also looked at who was most worried and how this worry was associated with well-being. So as Sarah Jane mentioned in the beginning, in terms of when this data collection occurred, it occurred in sort of the last quarter of 2021 and then along into 2022. So this is a time in New Zealand when we first introduced to the Delta outbreaks and the Omicron outbreaks and the sort of new living with COVID, I guess, which we hadn't previously been doing. Okay, so in terms of the methodology, we asked 3 questions about worry due to COVID. One was about worry about missing out on schoolwork. Another was around family finances. And then a third was around how people in the home were getting along. So today I'm going to take you through these results for the cohort and present our findings on who was most worried in terms of demographics or socioeconomic factors, as well as looking at the impact of household factors, relationship factors, and mother well-being.
I'll then take you talk about how worry about the pandemic was associated with well-being. So we use 3 proxy measures of well-being for this topic. Depression, anxiety, which you've just heard about from Ben. But we also looked at health-related quality of life. So this measure assesses health and psychological, mental, and social well-being. So overall, it was uncommon for young people to report that they were worried often or always about COVID-19. However, for 2/3 of young people, they were worried at least sometimes about missing out on schoolwork. So this graph here just shows you the frequency of worry, with never in the sort of dark blue and always in the light grey here. So next fewer younger people were worried about family finances or how people in their home were getting along, with only around 46% of young people never worrying about their family finances, and almost half of young people never worrying about how people in their house got along. Okay, so since the start of the pandemic, there's been several reports of differences in perceptions or impacts of the pandemic by gender. And our data is consistent with this. So we find that transgender or non-binary young people worried the most due to the pandemic. We saw similar patterns across the 3 COVID questions, whereby cisgender girls and transgender non-binary young people were most frequently worried compared to cisgender boys. So I'll just take you really briefly through these 3 questions, and I'll try and orient you to the graphics as we go through. So these ones here show the frequency of worry by the different gender categories. So on the left-hand side, we have cisgender boys, cisgender girls in the middle, and transgender non-binary young people on the far right. And the colors represent worry. So the color on top here, this dark blue, represents those who were never worried. Down the bottom in the gray, we have those who were always worried. And for those of you with good eyesight, you might notice this little yellow sliver down the bottom, and that represents the young people who told us they didn't know, or they don't know about this question. So as you can see for this specific question around missing out on schoolwork, transgender non-binary and cisgender girls were more worried about missing out on schoolwork than cisgender boys. Similarly, we see here in terms of worrying about family finances that cisgender and non-binary young people were more worried. And you can see a bit of a pattern here with an increase in cisgender girls compared to cisgender boys, and then a further increase when you look at transgender non-binary. We see similar patterns with worried about people in the home getting along due to COVID-19, with transgender non-binary young people being more worried than cisgender boys and cisgender girls. Okay, so COVID-19 has highlighted various health disparities, including ethnic and racial disparities. So overall, young people who identify as Pacific or Asian were more worried about COVID-19 than those who identify as European. So this box plot that I've presented here, which is a little similar to what Ben has already presented, has the overall worry due to COVID-19 here, a sort of combination of those 3 questions. And along here, we've got ethnicity. So when we look at the individual questions, what we can see is the pattern really differed by ethnicity dependent on the question. So for this one here, we can see that Mila and Asian were most worried about missing out on schoolwork. And just to give you the definition, Mila is Middle Eastern, Latin American, and African identifying young people. Next, we had worry about family finances, and Pacific and Rangatahi Māori were the most worried about family finances. So now, although differences were small for the next one, it did appear that Mila and Pacific young people were more worried about people in the home getting along due to COVID-19 compared to Seoul European young people. Okay, so in terms of area level deprivation, there was a general trend that for higher deprivation, there was more worry due to COVID-19. However, this trend was more pronounced for worry about family finances due to COVID-19. So you can see here for this question around worrying about missing out on schoolwork, there's a very slight increase in the size of this green bar across from least to most deprived. And this becomes more pronounced when we look at worry about family finances due to COVID-19. Similarly, you can see a same trend when you look at a worry about people getting along in the home due to COVID-19. Okay, so the next thing we wanted to do was to look at other factors that are potentially associated with worry about COVID-19. So based on the literature and what was available in the Growing Up in New Zealand data sets, we selected a few factors to look at. These included child demographic factors such as gender and ethnicity, socioeconomic factors such as material hardship and mother labour force status, household factors including household structure and residential mobility, relationship factors including child-peer and child-parent relationships, as well as mother wellbeing factors. And this included worries and fears due to COVID-19, as well as mother depression score. Now, if you'd like to know more about these analyses, I encourage you to go to our website and download the full report. In terms of what we found, as you may have guessed from what I've already presented, socio-demographics, including gender, ethnicity, and material hardship were all associated with worry. So we see that transgender and non-binary and cisgender girls were more worried than cisgender boys. Similarly, we see that material hardship was associated with more worries. So if you experience more material hardship, you were likely to be more worried about COVID-19. In terms of the relationship factors, we found that child-parent relationship was related to worry about COVID-19, such that if you had a stronger relationship, you were less worried about COVID-19. Again, not surprisingly, if your mum was worried about COVID-19, then you were more likely to be worried about COVID-19 as well. Okay, so now I'm just going to build a little on some of the research that Ben has just presented. We wanted to investigate whether worries and fears due to COVID-19 were associated with well-being in addition to the factors presented in snapshot 7. Okay, so overall, greater worry about COVID-19 was associated with poorer mental well-being. Right, so this first graph should hopefully be familiar now. This is very similar to those presented previously by Ben. So on the y-axis, we have the well-being outcome. In this case, that is depression. And on the x-axis, we have the 3 time points. In this case, 8 years, 10 years, and 12 years. In terms of the 12-year, this represents a subset of our cohort who completed a data collection wave during the level 3 and 4 lockdown. Okay, so in terms of these different lines that we have here, these represent the different categories or frequency of worry due to COVID-19. So in this case, we're looking at worry due to COVID-19 for missing out on schoolwork. So this top line here, if you can see these colors, they're a little hard to see, I apologize, represents those who worried always. And the bottom line here represents those who worry never. So what you can see is that if you worried all the time about missing out on schoolwork due to COVID-19, your depression score was higher, indicating you had higher depressive symptoms. Similarly, if you never worried, you had the lowest depressive symptoms. We see a similar pattern when we look about worry about family finances due to COVID-19, with again, with those who worried always having the highest scores across all 3 time points, and similarly, those who worried never down the bottom here. Again, we have the worry about people getting along at home, and we see a similar pattern. Okay, so next, like Ben, we looked at anxiety symptoms. And again, we found that increasing worries and fears due to COVID were associated with worse anxiety scores or greater anxiety symptoms in young people. So this first graph here, very similar to the graph I've just shown you. These results are very consistent across these two outcomes, with those saying that they were always worried about missing out on schoolwork, having the worst anxiety scores, so the highest level of anxiety, whilst those who had the lowest level of worry having the lowest level of anxiety. We see a similar pattern for worry about family finances, and then we see a similar pattern again for worrying about people in the home getting along. Okay, so the next thing we wanted to look at, so this is a new outcome, was the association between COVID-19 worries and fears and health-related quality of life. So we looked at this across the 3 questions individually, as well as that combination of the 3 questions. So in terms of the 3 questions, what we found is that it was only significant, so worry was only significant for family finances and worry about people getting along at home. So worrying about schoolwork didn't have a significant impact on quality of life. Now, overall, with increasing worries and fears due to COVID-19, the quality of life score was lower. Now, so this is the opposite to depression and anxiety. So whereby a higher score is better quality of life and a lower score is worse quality of life. Okay, so I think we probably can all agree that worrying, it's a normal response to an unknown or concerning situation, such as a global pandemic like COVID-19. I think this report highlights that worries and fears surrounding COVID-19 have potentially had an impact on young people's well-being. We see this in terms of their quality of life, depressive symptoms, as well as anxiety symptoms. So this Growing Up in New Zealand data really provides evidence for areas of worries and fears related to COVID-19 that potentially could be addressed or mitigated as part of the COVID-19 recovery, as well as any future pandemic planning. We see that young people who were most worried tended to be the same young people who already experienced social, economic, and educational inequities. This really supports evidence that COVID-19 has widened the gap for these groups, and there's a need for resources to support those in greatest need. So, for example, ensuring resources are available to help mitigate learning loss, particularly for those most impacted by the pandemic, and also thinking about policies that aim to improve financial stability during situations like a global pandemic. And these are likely to contribute to improved well-being in young people. So with that, I will hand over to our panel for the panel discussion. Thank you very much.
Elder Caroline, and thanks to Ben and Caroline for taking us really carefully through their analysis and their papers. You know, we've brought this panel together to have a conversation about what we see in some of the meanings that we each bring to the data that's been shared today. But I do just find myself taking a bit of a breath at how impactful that data is, and really trying to acknowledge the significance of research like this that shows that such young people in our whānau and neighbourhoods and communities are going through so much. So I do implore everyone on our call today. I know there's a lot of advocates and researchers and people who have opportunities to support young people in our audience. So I think this really is a tono challenge to all of us to think about what we're going to do to support rangatahi with their mental well-being. So that's my little reflection, but actually what I need to do now is introduce our panel for today. And I'm going to start off by introducing a colleague of ours Kirsten Sharman, who's the Principal Policy Analyst, Mental Health and Addiction at Te Pou Mahi Pūnaha System Performance from Manatū Hauora, the Ministry of Health. Kirsten's been walking alongside the study for a wee while now, and I really do want to acknowledge your work, Kirsten, helping to shape actually some of the papers we've presented in Now We Are 12, and for being here for this next discussion. I'm also really pleased to introduce two of our named investigators from the Growing Up in New Zealand study. Karen Waldy is a professor of developmental psychology at the School of Psychology here at Waipapa Taumataro, the University of Auckland. Karen's been a named investigator since the very beginning of Growing Up, and is really passionate about how we can further a broader and more full understanding of child and adolescent mental health. And then finally, our colleague, Dr. Pat Bullen, who's a senior lecturer specialising in youth development and youth mentoring in the Faculty of Education and Social Work at Waipapa Taumataro. Pat is an applied social scientist and is interested in contributing to the development of strengths-based, research-informed policy and practice. And I hope we can talk to you a little bit about that kind of approach, Pat, in the panel session this afternoon. So before I get into it, again, my thanks and appreciation to you all for being here today. Kirsten, I'm going to come to you first, please. I know you think about youth and child mental health a lot, and I wonder if there was anything not just shocking in the papers, but actually surprising to you in the papers about how these patterns of mental well-being are being shaped across the life course.
Kia ora. Thank you, Sarah Jane, and thanks very much to Ben and Caroline, and congratulations to all of you for achieving this milestone. Yes, you asked us to think about this question before the webinar started, and I have to say, and I hope this won't make you all hate me, but I wasn't very surprised by many of the findings. I felt that most of them are very much aligned with what we'd expect to see from smaller New Zealand studies on different age groups and international evidence. But that's not at all to say that the research isn't important. It's actually incredibly important for us in policy to have recent New Zealand evidence to point to, because if we are just relying on evidence from other age groups or from other countries, we can never really be sure if it really does apply here. So it's really fantastic to have this really confirmatory understanding that we do think that we know what is going on here. We don't know everything, obviously, but the pieces are coming together and we're building a picture. And I have to say that from a policy and research perspective, some of the Growing Up in New Zealand studies, major contributions have been a bit more on the techie side of things. For example, validating the tools that you use to assess anxiety and depression in a young New Zealand population. I believe I'm correct in saying that we didn't have that until you came along. So that's great to have. And that's going to be really beneficial to future researchers and future work in this area. I have to say, if I did have to say one thing that I was a bit surprised about, it would be the clustering of the scores across the ethnicity and deprivation bands. So as Ben mentioned, there weren't statistically significant differences, but just looking at the scores on a scale that went from 0 to 30 for depression, for example, the scores were less than, or were around 1 point different between the different groups. So our young people really showed very consistent scores across those deprivation and ethnicity groupings. And I think it's really important to be positive when we talk about our young people's mental health and well-being, because we know that that they've got so much strength and are so involved in their own lives and have got so much to contribute. It's really important not to just focus on the negatives. And I think that that clustering effect that I just mentioned really is telling us from a policy perspective that all of our communities and all of our whānau have got the ability to really support and promote strong mental well-being. So everybody in New Zealand can do that. We can all work together to ensure that our young people are doing as well as possible.
Elder Kirsten, thank you for that. And I agree. when I look at these data, actually what I take away is actually what is our responsibility to enable young people to feel good and to be enjoying the things that they want to enjoy. But some of the data that's come through these two papers for me really talk to the conditions in which they're living, and that's potentially some of the area where we could be focusing our attention and thinking about how we create conditions for positive mental well-being for these young people. Pat, with that in mind, I might turn to you next, please. Again, I know that you do some close work with young people in and outside your role here at Waipapa Taumataro University, and wonder for you, this question of feeling surprised by the data. Does it surprise you given what you see in your close work with young people?
Sure, it is, Sarah Jane. I guess I'd like to start with acknowledging that that most of our young people are well, and I think that's important to recognize. And I think what this data tells us, or what these data tell us, is that there are perhaps groups of young people who are more vulnerable than others in terms of risk factors around mental health. And I think the thing that stands out for me is that downward shift in the age of onset. And similar data have shown the same patterns where young people are presenting with depression symptoms at earlier ages. And I think that's the thing that is most concerning, and it really has to then change our shift in how we approach that, in thinking about how we support young people in primary school and intermediate school. In addition to that, I guess the other thing is the link, or the thing that was surprising was the fact that there weren't these differences that you'd expect across deprivation and ethnic groups. And for me, that was something that was surprising, because I did expect to see perhaps greater prevalence amongst those within higher deprivation groups, and sadly greater prevalence amongst Rangataki Māori and Pacifica young people, because that's what other data have tended to show us. And I just wonder if this speaks to perhaps the cumulative effects of discrimination, marginalization, inequity, and how this potentially impacts our young people. Again, thinking about how we get those supports in place early, and really acknowledging that the sooner we do that, the less likely our young people are to suffer in terms of mental health.
Elder Patton, I think there was a really great question in the Q&A there that was sort of asking about how we use this information to think about more coordinated support earlier for young people in that primary intermediate setting. So you might want to type in into that really great question. Thank you. Kia ora, Karen, I'm going to come over to you. You know, and I think this idea of accumulation, you know, that is a very strong part of the methodology and the thinking that we try to bring through into growing up in New Zealand. And so whilst we are highlighting what mental wellbeing looks like at 12 years of age, again, I wonder for you, your thoughts on how this reflects actually some of the early life conditions. And I see in particular the importance, I think, of supporting mothers to feel well as an opportunity to support the young people to feel well. And I know that you've also done work there. Any thoughts around either of those issues?
Absolutely. I mean, the Growing Up in New Zealand study is just amazing, because it started before the study member's birth. So we are able to look at maternal mental health and what her activities were, the partner relationships, and so on. And that's always really interested me, that sort of pregnancy environment and early life, how that really impacts on outcomes. And so, you know, this study, the longitudinal nature of it, you know, studying young lives over time is pretty unique and special. So it is interesting and not surprising that mothers' mental health is a significant contributor to their offspring's mental health. And I think that's been one of my key messages with my research with growing up in New Zealand, that, mothers not feeling well, feeling depressed, feeling stressed during pregnancy and postpartum will really have an impact on the child and family development. So I think for policy, we really do have to recognize that it starts, way before the children enter the scene, that it starts with mothers and whānau and the connections there. So once the child is 12, yeah, we've got some real concerning findings about their depression and anxiety symptoms. And again, we've got some hope with the good relationships with parents and friends, showing how important they are for good mental health outcomes. But I guess what concerns me, in addition to how early the high depression symptoms are showing up in our cohort, I guess it's the extent to which bullying has come out as being such a big factor in poorer mental health. And I think that's a real issue in our country. I think internationally it is. I'm originally from Canada, and I don't think we have as much bullying according to the literature, and I could be wrong, but it is certainly a concern here in this amazing country, and we've got to be careful. We've got to be more aware that it exists. We were looking at things like being teased and physical bullying, cyber bullying, social isolation, which can be incredibly impactful at this age. I mean, this is early adolescence. These young people their bodies are changing, their minds are changing, and we know what those peer relationships, how important they are. So yeah, these high rates of bullying and the association with poorer mental health, I think is a big concern, and something that we could hopefully address in policy.
Kia ora, Karen, and thank you all. I'm not surprised that you were not surprised by the data, because as you've all pointed to, whilst there's unique aspects to what we can contribute to the picture of mental well-being and worries and fears that young people experience here in Aotearoa, it is part of a broader, very evidence-rich landscape that we have here in New Zealand. And so that's why I'm really interested then in the opportunities that we can create through data such as ours, but also other similar work. And I'm not sure, Kirsten, if there's anything that you could share about the work that Manatū Hauora are leading out in relation to mental wellbeing. But also for the rest of the panelists, I think there might be this thread here about how we connect the dots, not just the evidence dots, to help shape what policies and programs look like, but perhaps examples in the community, in services, maybe some opportunities for young people, and the work that they're really doing for us to help bring together to make a difference for mental wellbeing. So Kirsten, anything that you could share about where Manatū Hauora is thinking in relation to this?
Yeah, absolutely. Thank you. Manatū Hauora's, and in fact the government's policy statement on promoting mental well-being is called Kia Manawanui Aotearoa, Long-Term Pathway to Mental Wellbeing, and you can find that on our website. And that's basically taking forward the recommendations of He Ara Oranga, the report of the government inquiry into mental health and addictions from 2018. So what we're doing, what our approach is in these documents is to really take a much broader social determinants focused bioecological framework type of approach to mental well-being. And we're using the term mental well-being rather than mental illness, mental distress, or mental health. Kia Manawanui has a framework, which is an ecological framework. And if you think of the circles, the outside circle is that everybody in New Zealand needs to have the resources they need to thrive and to live in mentally well-being promoting societies. And then it goes in through communities being able to promote mental well-being, communities being able to address mental distress, and then getting into the service continuum, so primary, specialist, and other health services. So I think this is really aligned with your findings, Sarah Jane, because as you pointed out, what these findings are saying is that people need to live in the environments in which they are able to express or have the best possible mental well-being. That is their right. And in policy, we like to think in frameworks because you can't, the world's too complicated. You have to have an analytical framework. And the analytical framework that we're currently using is that mental well-being is the product of the interplay of risk factors and protective factors. So as government, what we need to do, and it sounds simple, is increase the protective factors and reduce the risk factors. So we don't want to just focus on reducing the risk factors. We want to be strength-based, and that's really important in Aotearoa New Zealand, that we take those strength-based approaches, because that means working with our communities, our whānau, our hapari, iwi, civil society. So mental well-being, sorry, this is a terrible cheesy line, but mental well-being is everybody's business. Supporting parents, as Karen's, I think it was Karen, it says you're Hannah, but you're Karen, aren't you? As Karen said, supporting parents is essential, and that's the work of everybody. So the health system has a role there. We're not resiling from that, and government broadly has a role, but so do everybody else in society. So yeah, Kia Manawanui, that's on the website, and that's really guiding all of our work. That's for the population as a whole. In the child and youth space, the Child and Youth Wellbeing Strategy had a new priority focus area added to it last year, which is to support child and youth mental wellbeing, and Manatu Howard is leading out on that as well, with the support of a number of our key colleagues, such as the Ministry of Education, Oranga Tamariki, and the Office of the Children's Commissioner, all of whom I can see are on this webinar. So thanks very much for coming along, guys. So yeah, I did answer a quick question in the chat about our Mana Ake program. I can talk more about services if that's what people are interested in. But yeah, I think that we've kind of got two interests here. So we're very interested in the findings and what they tell us about mental well-being, about the balance of risk and protective factors, and how families work, and the channels, you know, which comes first. Is it mobility or is it stress, and you know, those kind of things. But then we obviously also have an interest in the findings around the service access. So we're keen to dig into that with you a bit more. We're not completely sure at the moment, things like what services did people access? Did people actually understand that they were accessing a service? Because some of the support that we provide isn't a service. It's things like psychosocial support through the COVID response, online support, health promotion. We've got things happening in schools, often in conjunction with our colleagues at the Ministry of Education, which might not have been perceived as services. So we're interested in finding out more about that. And we're also interested more in digging into this question about, did the service deliver all you needed? And is it really reasonable to expect a service to deliver everything you need? What were people thinking when they answered that question? So yes, plenty more conversations for us to have with you, Sarah Jane.
Elder Kirsten, thank you for sharing that. And you know, as a Māori public health person, I really appreciate the way in which it sounds that Kia Manawanui is trying to bring us all into the frame and find the balance between the risk and protective factors. I know in some other conversations, you know, there's real interest in enabling whānau and communities to maybe focus in that protective space, that they know what works well for them. So how can we come and support them to do that, whilst perhaps some of the rest of us are thinking about the risk reduction particularly in your area that you mentioned, Karen, around bullying. Pat, you've also talked about discrimination and the marginalisation. I think there's some really important thinking to be done around the sort of intersection of all of those stresses in these groups of young people who need extra support. Pat, I did want to see whether or not you've got anything to share with our audience today, maybe around examples or programs that you see working really well for young people, because again, I'm mindful that we don't always have to start from scratch. There's probably examples out there, and this might be a nice chance to highlight some of that and give people inspiration for what we could all do next.
Sure, Sarah Jane. I don't have any programs specifically off the top of my head that I would advocate for, because there are so many out there. But I think that any program for young people has to be youth focused and youth friendly and engage with them in a mana enhancing way that doesn't stigmatize or create a sense of embarrassment or a sense that asking for help is wrong or an indication of weakness. And so it really is ensuring that all programs can support young people where they're at in the way that they need to be supported. And I think mental health services need to be different for young people than they are for adults. Confidentiality, being, again, youth-focused and understanding youth development is critically important in the provision of those services. And I think the other thing that's really important is the timeliness and the access, is that when young people are struggling, they need to have access, and they need it then. They don't need it in 3 weeks' time or 4 weeks' time. And so, we need to make it accessible and easy for young people to have access to those services. And so things like having that presence within a school environment, again, where it isn't stigmatizing, where a young person can go into a counselor and not worry about if they're seen, is that a problem? Because everyone's accepting that we all need support at some point in our life. And this is a normal part of growth and development. I think, Sarah Jane, the thing that worries me too is that our young people are 12 years old and about to embark on a big journey as they approach secondary school, and doing what we can to upfit them and build them up so that they are prepared to really embrace this transition and experience in terms of high school is incredibly important. I'm not sure if that answered your question, but it's kind of my thinking around it.
Pat, I appreciate that. So I'm mindful of the time here. I'm just going to quickly check into the Q&A there. I can see our team has been in and helped to answer some questions. Thank you. It's great to see colleagues from the youth survey, Rupu, who are online today, have done some really important work in the space of youth mental health and wellbeing, and also, as Kirsten mentioned, colleagues from the Office of the Children's Commissioner. We've created a little bit of a pattern here in our webinars, where, just to close out this conversation, when we're often talking about some of the challenges that young people experience, to bring a little bit of hope back into our space. And so I'm just going to ask all of our panelists just one question. It can be shorter, it can be long, but just to really ask if you'd share with everyone here what some of your hopes are for the mental well-being of rangatahi here in Aotearoa. And I'll start with you, Kirsten. Your hope, please.
I was hoping I could be last. So many hopes. I think that I just have to fall back on the aspiration of the Child and Youth Wellbeing Strategy, that New Zealand's the best place to be a child and a young person. And so part of me doesn't like that aspiration, because I don't know if we should be comparing ourselves to other countries. We don't need to be better than somewhere else. So I'm choosing to interpret it as New Zealand's the best that it can be. We are the best that we can be for our children and our tamariki and rangatahi.
Kia ora, Kirsten. Thank you. Appreciate that. And for you, Karen, your hopes for young people's mental wellbeing.
Yeah, I'm going to follow on Kirsten's line here, and we know it takes a village, and New Zealand is the best village to be living in. So my hope that our people are good. They might need to get a little bit better at recognizing early warning signs of low mood and anxiety, and get better about talking about mental wellness. But I'm hopeful. This is a good place.
Kia ora, Karen, and finally over to you, Pat.
Sure. I think my concluding comments would be that all of the things that we look at that result in vulnerability in terms of mental health are preventable. And so with that in mind, I am forever hopeful that we can create a place where all young people feel valued, respected, included, and cared for. And I think that those sound like difficult things, but I don't think they are. And I think we can do that every day in the work that we do and how we approach, how we treat young people. And we need to invest in our young people because they truly are our future. And they are bright, they are ready to embrace the challenging world ahead. And they just need the support to do that.
Pat. And so with that, I'm going to thank and express my gratitude to our panelists today. Thank you for being here and sharing how you see the space of youth and rangatahi mental wellbeing, and also just to thank again the people from our team, Ben and Caroline, for their presentations, and to everyone in the audience. I hope you take some of those hopes and aspirations with you into your work. Our young people deserve to feel well and to live in an environment who appreciates and acknowledges their potential. And I think that's part of our job as advocates here today. I do want to just leave a little bit of a reminder for you all that the work you've seen here today is just that. It was a snapshot into the life of 12-year-olds here in Aotearoa. The information that you've seen is part of a rich data set, which is available for your really important questions. And we need really important questions to help achieve some of the hopes and aspirations that whānau have for their young people, as well as our panelists today. So please do engage in the work that we've presented to you today, but also to go to our website and to learn about how you can use the Growing Up in New Zealand data for your own research and policy and advocacy here in Aotearoa and with your other colleagues. So once again, we're right over time, but I just want to thank you all for your presence today. And please come back for our fourth and final webinar. We will be thinking about the importance of relationships for young people's wellbeing and presenting again some really important work about experiences of disability within our cohort. So mōri ora kia koutou katoa. Thank you for your time.